Boy, we all know someone who's dealing with the heartbreak of infertility. It's a challenging struggle. It's a hurdle. A lot of people get success and a lot of people don't, and it's hard to know if it's going to work or not. But there are new advances that are making it very exciting. So Reproductive Endocrinology, that's a tough one, endocrinology and infertility specialist Dr. Bentov is here to discuss some of the new exciting treatments and just in general get some information about infertility, because it's probably more common than people realize, right?
Actually, it's really common, and it's getting more and more common. It's 1 in 6 Canadians.
1 in 6.
1 in 6 Canadian
Is that
families.
men and women?
That's couples.
Okay.
And it's about twice than it used to be in the 1980s.
Is that because people are starting later, or there are environmental factors that are at play? Why do you think there's such an increase?
Sorry, there's probably several reasons, but I think the main cause is that for different reasons, social stresses and culture and work, people are delaying childbirth. I think the average age for first birth in Ontario is 30, and the average age of patients that walk into our clinic for the first time is 39. So definitely people are taking their time and getting pregnant. That causes a lot of problems.
It sure does. Yeah. And we spend all those years trying not to get pregnant while we search for Mr. or Mrs. Right.
Correct.
And then we say, okay, now I'm ready. And our bodies fail us. It's very frustrating and heartbreaking. How many babies in Canada are born using IVF, in vitro?
Well, the numbers are increasing too. I think it's about 14,000 kids a year.
Wow.
And again, so the numbers are getting bigger and bigger. Hopefully there's going to be news about funding for in vitro in Ontario, so maybe the numbers in Ontario will also increase.
That's exciting, because financially it is prohibitive for so many couples who deserve to be parents, who should be parents.
For sure.
Just because they can't afford it. It can cost, well, depending on how many times you do it, tens and tens of thousands of dollars.
Right.
So let's talk about what are the causes of infertility and why it's a problem.
So, so there's several known causes. Mechanical factor, which is the blockage of the tubes. Male factor, which is when the sperm is not so good. There could be ovulatory dysfunction. Polycystic ovarian syndrome is one of them, when there's no ovulation, irregular cycles, not many...
Yeah, if you're ovulating irregularly, you can't...
Or not ovulating at all.
Or at all.
And there's age. There's age-dependent infertility, which is the biggest nut to crack, because until now, we didn't have any good treatments to solve this problem. And I think one of the exciting news is Augment, which may be a solution for this problem.
That's great news. People like me, there was nothing they could really put their finger on as to why I wasn't getting pregnant, and I did it all, except probably my eggs were just too old, right? So this is going to treat the eggs, is that right?
This is a new treatment that is aimed at improving the egg health. We know that as women age, their eggs are not doing so well in terms of the outcome of the pregnancy. They're harder to fertilize, they form bad quality embryos. Those embryos frequently result in a miscarriage. And when they tried to pinpoint what the problem was, they seemed to point on the mitochondria, which is the part of the cell, of every cell in our body, that is in charge of producing energy, as the cause of this very poor outcome in older women. But it's also some younger women that develop poor quality embryos, and those probably also suffer from the same condition.
Interesting. Could that be, if it's happening in a younger woman, could that be environmental or nutritional issues or something? Maybe,
but we know that women that had the hard time getting pregnant have some family history of also difficulties getting pregnant too.
The mitochondria. We can't see those with the naked eye.
No, those are very, very small organelles. It's actually an interesting story. There used to be bacteria that became part of our cells a long time ago, and our cells learned to live in a symbiotic way with those organelles.
Now we depend on them.
We completely are dependent on them, especially the eggs, which are totally dependent on mitochondria. They cannot produce energy in any other way.
How on earth do you make them healthier?
So, you know, the eggs, you're born with all the eggs that you will ever have. So it's the same eggs that you ovulate when you're 15 and when you're 40. So it's like leaving a flashlight on the shelf. Over time, the batteries kind of become less effective and less efficient. It's the same thing with the mitochondria. It's the same mitochondria, and over time, because they're producing energy. They also produce all kinds of other substances that eventually affect their ability to produce energy. So we've been studying mitochondria for a long time. We tried many different ways to try to improve their function. But the Augment, this new procedure, we actually add to them mitochondria which are more efficient.
Where do you get those?
So there used to be a lot of study trying to do this before. So they took those mitochondria from other women or took the mitochondria from other cells. But we came to realize that this is not good. It created a lot of problems. With Augment, we take the mitochondria from egg precursor cells, which are stem cells that cover the ovary of the same person. We do an ovarian biopsy. We take a very small piece of the ovary and we extract those cells that apparently have really, really good and functional mitochondria.
Wow.
And those mitochondria are injected to the egg and they improve the ability of the egg to produce energy. They actually recharge or boost the energy.
Amazing.
Yep.
So these are eggs that have been extracted, and then you've done the process to retrieve those mitochondrial cells. Am I saying that right?
Correct.
And somehow you are injecting that into that teeny tiny little egg, and then that egg goes on to be fertilized, develops into an embryo, and so on and so on.
Correct. It's a part of an in vitro treatment. So there's a separate phase in which we do the biopsy, we do the extraction of those cells, and then at the time when we get the eggs out during the in vitro, before we inject the sperm into the egg, this is when we inject the mitochondria. And then we follow up on those embryos and we see what happened, in what way and fashion they develop, and then we choose the best one and put it back.
It's quite it sounds very, very scientific and very clinical, and it all happens in a lab, but it's actually a very beautiful process.
It is an amazing process.
And it's quite remarkable. It's breathtaking, and the people who are involved in it have to be caring people, because we're talking about future. They're creating future people, and they're helping in the happiness of couples all over. So we thank you for all of that good work and all the research you've done. So this new Augment system is available to anyone who needs it?
It's available for anyone that needs it.
Who is using your services?
Exactly. Specifically for patients who had a previous in vitro with poor quality eggs, or older women, and older is over 35, that want to try and conceive from their own eggs.
That's right, because otherwise really the only option at that point is using egg donors, which is a tricky business in Canada. It's a little easier in the States, but you got to pay for it. So in Canada it's tougher. And so this way they don't have to make those leaps of ethics or
Absolutely.
Trying to get their head around that. They're using their own body.
Absolutely.
That's amazing.
So that's a step to try and improve the egg health, the health of the embryo, and maybe to avoid needing to use someone else's egg.
Fantastic. And let's hope that the people who are able to make those decisions choose to start funding some of this with our provincial health programs, so that it can be accessible to people who really truly should be parents. I can think of many people in my head right now I know personally who should be parents. Thank you so much.
You're welcome. Thank you for having me, Mel.
Where do we contact you if we want more information?
So our website is TCART.ca. That's the best way.
TCART.ca.
Yeah.
Okay. And get the process started, right?
Thank you.
Thank you so much. All right. Good luck to you if you're wanting to have a family.